So I'll go backtrack and then go forward. So my personal preference is for the at-risk kids to get tested. Now, the school could put all the students through, not test them. That means you got to put every child through this intensive 90-minute daily instruction. But that is the crucial part. So also, I think if you test the child and we know they're dyslexic, then if they leave your school or they go other places, they have a name, they know why they're struggling, they'll get accommodations for life. So that would be my recommendation to the schools, knowing that it is intensive, but I think the benefit for the children is there. And then before we go to the testing, we do test at Louisiana Key Academy, but we do not have a psychologist. We have these certified academic language therapists with master's degrees that do the testing, just to be clear on that. So there are different options depending on your school system.
I think that's very important. And Dr. Cassidy is making a very important point. Unless you're going to put all the children who screen as at risk through this very detailed and intensive program, you might as well make sure that the children are dyslexic. Saying that, Dr. Cassidy found that most of the children, in a recent study we published within the last year, most of the children who tested at risk with a screener, when we put them through testing, they were indeed at risk. They were indeed more than at risk. They tested as dyslexic. Not everybody, but for the most part, most of them. So maybe, did you want to talk about the kind of testing that you do, Dr. Cassidy?
So again, just to summarize for people, the screening is the at risk or not at risk. Then those that are at risk, we recommend to go on to testing. And what we do at the Louisiana Key Academy is we're just testing for dyslexia. There are other things that might be appropriate for the student, but what we do and what we want to do for sure is to find out if they're dyslexic. There's concern on our test that more testing is needed, then we'll refer them to a psychologist for more testing. But let's go over what we need to do to make that diagnosis of dyslexia. And it is a clinical diagnosis, also with testing, looking at different skill sets, and it fits the definition of dyslexia in federal law, and which we also have in Louisiana law, which says dyslexia is an unexpected difficulty in reading for an individual who has an intelligence to be a much better reader, and that usually this is due to an isolated phonological processing deficit. So that the testing is going to match up to that. So do you want to start with the clinical history or with the testing itself?
So let me just, I want to emphasize what you just said. So the federal definition of dyslexia, which is in Public Law 115-391, is that it's an unexpected difficulty in reading for an individual who has the intelligence to be a much better reader. And that is also, I know, the Louisiana state definition. And the beauty of this definition is that dyslexia is an unexpected difficulty. It can be unexpected for age and unexpected for ability. So that covers just about all the children who would have dyslexia. And so your testing is going to not reflect, but being guided by that definition. Unexpected for age and unexpected for ability. And so why don't you talk about the typical testing that you do at LKA, Laura, and I can elaborate on any of them as you talk about it.
Okay, so we start with the clinical history. And that's really important. You know, if it's a first grader, someone that just finished kindergarten, we would talk, because it's easy for the parents to remember if they're 6 years old. It's a little bit harder if they're coming in at 10 and 12. But we're looking for, did they have any speech delays? Did they have trouble rhyming? Did they have trouble learning the alphabet? Saying the alphabet, knowing the alphabet one day, not the other. And then if they've started the process of trying to read, are they having difficulty there? So, and then as they get older, of course, we're looking at spelling and other things. But that's the early signs for dyslexia. We also like to get information from the teacher, because again, the teacher is going to have a broader look, a broader evaluation of how the child's done in school than any one test or one moment in time, as Bennett talked about earlier. So the testing, what we do is we do an intelligence test, and that's crucial. And I do want to talk about that in detail. We do the CTOP, which is important to look at this phonological awareness and phonological processing. We do the TOWRY, which is a time test looking at nonsense words for decoding and also sight words. We do an oral reading fluency test, which is incredibly important. I mean, I try to help people understand, if you listen to a dyslexic read out loud, it's gonna tell you a lot. If you've never listened to the child read out loud, you're really missing the intricacies and the real development of the child's reading. So those are our main standardized testing that we are looking at. Sometimes, like I said, we have to do additional testing, but that is the core of our testing for LKA.
That's a beautiful summary, Dr. Cassidy. So what Dr. Cassidy is doing, she's giving an intelligence test because she's going to see whether the child has an unexpected difficulty in reading, unexpected for ability. There are other tests give standardized measures of reading, and that will give her satisfying a definition as unexpected difficulty for age. The test that she's using, she's using a very good test of phonology, because the basis of dyslexia is a problem getting to the sounds of spoken language. That is the phonology. And the CTOP is such a test. It asks children to say words. If you say the word stop without the T, it allows them essentially to pull apart the words into the separate sounds. So she uses that to get a sense of phonology. She has tests of reading fluency, and the TOWRY and reading fluency is reading words quickly and accurately and with good intonation. And so the TOWRY, you're reading individual words, isolated words, both real words and pseudo words, nonsense words, and you're reading those as fast as you can. But then, in addition to that test, she's using a test of connected text. You use the Ames, Laura?
Ames Web, yeah, it depends, and we use both Dibbles and Ames Web. So
Yeah.
Either one, I think, oral reading fluency.
Those are measures of connected text, the little paragraphs that the child reads aloud and as fast as the child can read them. And that's really important because it allows you not only to hear the child reading, it allows you to see how the child's reading reading in connected text or a paragraph. That's what you want them to do. And so those are very, very good measures. And that's sort of the basis of the reading test. Now you can be, as Dr. Cassidy says, if there's any question, you can give more tests. There are standardized tests of reading, very good ones, the Woodcock-Johnson, the Kaufman, the Wyatt. They're all standardized tests of reading that have many more components, but they may not be necessary if you can make the diagnosis with this very concise battery of tests that Dr. Cassidy just mentioned. I should just say here that there's a very good data to say that if you say, we don't like the term learning disability anymore because it's very nonspecific. 80 to 90% of children who people say have a learning disability are in fact dyslexic. So that's most of the children who have learning disability are in fact dyslexic. So by focusing on dyslexia, you're really capturing just about all the children who are in this category of learning disability. I think Dr. Cassidy's battery is really concise. It takes more time than a screening test, but it also, and it's evidence-based. And it's very, very, and as Dr. Cassidy says, with that, with those kind of, with that more detailed testing, you're going to know whether the child you're going to put through this fairly rigorous 90-minute a day of reading instruction really is dyslexic. And so it seems to me that that is the beautiful battery, and other schools should consider adopting it.
Right. I think it gives, because there are so many kids with dyslexia, that there has to be a path that will allow the children to be identified, because we know that the child that's identified and gets this evidence-based instruction is going to have a much better prospect in life than those that continue to struggle, that are never identified and not given the instruction they need. So the identification is crucial. So we want to make it where it's feasible for all school districts to do this. And then we want to make sure that the instruction, as we said, meets those 5 pillars for that length of time and that frequency. I do want to go back though, because again, this unexpected difficulty for ability or for age. I know people have questions on the IQ test. So we're looking for an IQ of average to above average for dyslexia. And there's a graph that we will show. And Dr. Shaywitz, you could explain that about the influence of IQ and reading on those that are dyslexic versus those that are not dyslexic.
The reason Dr. Cassidy is emphasizing the unexpected for ability and unexpected for age, the beauty of this federal definition of unexpected is that it encompasses children who have poor reading that is unexpected for ability and unexpected for age. We're emphasizing that because you want to make sure that children who are average or above average intelligence and are reading well below that still are identified as dyslexic and receive the intervention that they need. We over a decade ago, we used the data from the Connecticut longitudinal study to show that in typical readers, IQ and reading are linked. If you're bright, you read well. If you read well, you're bright. And there's a very nice graph of this data in Sally Shaywitz's book, Overcoming Dyslexia, page 103. But you can see that in typical readers, IQ and reading are linked. In contrast, in dyslexic readers, IQ and reading diverge. You can be very smart, but your IQ is much lower, but your reading is much lower. So the IQ and reading diverge. And that's really critical. And it is over 10 years ago, it validated the unexpected nature of dyslexia. So there shouldn't be any argument. What I think Dr. Cassidy and Dr. Shaywitz and myself are concerned about is people say, we don't use a discrepancy definition. Forget about that. You're using an unexpected definition, and it's unexpected for age or unexpected for ability. So you don't have to get into these endless arguments about we don't believe in discrepancy, or we don't believe it's unexpected. The unexpected covers both children who are unexpected for age and unexpected for ability. And you have the scientific validation of unexpected as a great definition. You think we're making the point, Dr. Cassidy?
I think, again, that graph that shows that dyslexics' IQ is not influencing their reading. So if a person's IQ is off the chart and they're reading at an average rate, that's unexpected. You'd expect them to be reading off the chart. And so it's important. Now, if their IQ is average or a little bit above average, you would expect their reading in these reading tests to be above average. And then when you look at the unexpected for age, you're looking at the standardized testing, the ranges for their age, but you're also making sure that their IQ is average to above average so that it's an isolated deficit it's not an intelligence issue causing the problem with reading. It's not and that's the clinical history that's important. It's not another entity causing problem with the reading. This is just unexpected because there are no obvious reasons that the child isn't reading, except for when you understand dyslexia, that it is a problem due to dyslexia. How does that make sense?
I think it makes a lot of sense. I think as a rule of thumb, unexpected for age would be on a reading test, a standard score below 90. And every reading test that's well validated. You can see who's below a 90 standard score. And if you're looking at unexpected for ability, as Dr. Cassidy said, someone who's has a very high IQ, but is reading at a much lower level, that would be unexpected for ability. And as there are algorithms to use, but a rule of thumb is verbal ability on an IQ measure as the measure to compare. And so if your verbal ability is 20 points higher than your reading, then that person has an unexpected difficulty in reading because of ability. So those are just sort of shortcuts. There are you can get a little bit finer gradation when you're if you use an algorithm, but those are pretty good rules of thumb. What do you think, Dr. Cassidy?
Yeah, and I think once that it's helped at the school. I think because we've been doing this for so long, I think we've gotten better at this, and we've not only tested for admissions, we've had the children in, we've been able to see who the program works for, maybe fine tune the testing and assessments better. We're here to try to help people again identify these kids so that they can get into an evidence-based program. And I do think we should close on one thing that's important, because some people say, oh, why do you want to identify them, or you're going to over-identify dyslexics? And it's so important to know why you're struggling. Dr. Sally Shaywitz talks about this so well, that there's a name to your struggle so that you know that you are smart. But you have something called dyslexia, which does affect your reading, but that you can reach your full potential. The school's responsibility is to give these kids the correct instruction for the frequency and the intensity and the duration that it's needed, and the accommodations for life.
This is Sally Shaywitz. I just wanted to add that it's very important for the student to know that she or he is dyslexic. It's empowering. It provides the student with self-understanding and self-awareness of what she or he has and what she or he needs to do in order to succeed. It provides students, too, with the community to join. They know they're not alone. And for the parent and teacher, and most importantly, the student, the knowledge that she or he is dyslexic brings with it the information that the individual is not stupid or lazy.
Right. So I think that it's empowering in a very positive way.
Yeah.
Well, I thank y'all for being on this podcast. I feel like it was very good, and I hope it helps people out there. If you have questions, you can reach us at the Dyslexia Resource Center. We are here. We offer different services to help the dyslexic child. But if you have questions on anything that was said in the podcast, please reach out to me or to the Dyslexia Resource Center. And we look forward to the next broadcast. Thank you again.
Thanks, Dr. Cassidy.